Congratulations, you just finished your dental procedure. Now that you're ready to go home, I wanted to leave you with a few tips as you continue your healing journey. Now, feel free to replay this video as many times as you need. It's important to follow these instructions until I see you in the next 7 to 10 days. Remember, you're going to be numb for the next 2 to 5 hours, so avoid eating until then so you avoid any type of biting of your lip and tongue. Not good. So, in the healing process, it's important for blood to clot, to form, to stop bleeding as you're beginning the healing process. So, you want to use some gauze. You want to bite down for the next 30 to 45 minutes. If the bleeding continues, certainly you can place another gauze for another 30 minutes. We want good clot production, so it's important to avoid smoking in the next 48 hours, sucking through straw, and rinsing the mouth vigorously. Don't do that. Avoid any type of activity, working out for the next 2 weeks because excessive movements will increase the heart rate and increase blood flow and cause a lot of pain and swelling. Now, one of the main causes of failures and complications is food contact. So, if you don't feel like cooking, feel free to try one of our superfood recipes we have in your care package. In the next 5 days, please maintain cold temperature liquid beverages. That's always a good start. In the next 5 to 7 days, you can increase up to like a mushy consistency, such as mashed potatoes and blended foods. Now you're working up to 2 weeks, so you can work up to soft to semi foods, solid foods like fish, pasta, soft meats, and things like that. Avoid hot, crunchy, and spicy foods for the next 2 weeks after the procedure. Now, to manage discomfort, it's important to take your prescribed medications as I prescribed it. If you've had dental implants or any type of bone graft, it's very important to take your antibiotics. So, take your antibiotics without missing a dose until completed to prevent any type of infection. If you've given a second antibiotic, it's very important to finish the first antibiotic and then move on to your second antibiotic. Now, it is normal to expect swelling and bruising as you may see it peak in the next 72 hours. Now, an ice pack is certainly going to be helpful. You can place that on your face in the area that we've operated for about 15 to 20 minutes, and you can rest about 5 minutes at a time. Continue that for the next 5 hours. Swelling can be minimized by elevating your head with some pillows. We want you to avoid brushing and rinsing the area the day of surgery to minimize bleeding. So, day 2, go at it, but be gentle. We want you to brush the unoperated area. And the operated areas, we want you to rinse your mouth. You can use this prescribed rinse. You can do that 2 to 3 times a day for at least 30 to 60 seconds as you can tolerate it. If you're wearing a denture, which is replacing teeth, and it's over implants, we've designed this to minimize any type of pressure in the surgical area. Any pressure in this area would be very detrimental to your healing process. If you've had teeth removed and no dental implants have been placed, we call this an immediate denture. This is designed to act as a Band-Aid, so leave it on until I see you. Now, we want treatment to provide you a healthy and a positive healing experience. So, if you run into any problems, you can either replay this or feel free to give us a call at the office at 267-322-1478. I'm Dr. Silva, and I'll see you in 7 to 10 days.